Good morning. My name is Iliya Goldberg, and I'm a second-year resident at Stony Brook University Hospital, and I'll be presenting on surgical trainee impact on bariatric surgery safety. And I would like to thank SAGES for allowing us to present this. How do I go to the next slide?
The mouse.
Yeah. Oh, I have no disclosures for this presentation. So surgical training revolves around three main essentially concepts: patient safety, the quality of patient care, as well as surgical outcomes. Bariatric fellowship training in numerous studies is shown to lead to lower blood loss, shorter operative duration, and less intra as well as post-op complications for laparoscopic Roux-en-Y gastric bypass compared to individuals that have not undergone formal bariatric training. Furthermore, resident and fellow participation has been shown to prolong operative times in various types of surgeries, including appendectomies, hernia repairs, various vascular procedures. Specifically for laparoscopic sleeve gastrectomy, there were studies that showed higher readmission rate, urinary tract infections, pulmonary embolism, and superficial surgical site infections with resident and fellow participation. And lastly, there's studies that showed that robotic surgery, Roux-en-Y gastric bypass, and sleeve gastrectomy have a shorter learning curve. So the purpose of our study was to assess the impact of trainee operative involvement in early perioperative safety as well as outcomes of bariatric surgery for both robotic and laparoscopic sleeve gastrectomy as well as Roux-en-Y gastric bypass surgeries. So our methods, we used the Metabolic and Bariatric Surgery Accreditation Quality Improvement Program database for 2015. And that was specifically for non-revisional laparoscopic and robotic Roux-en-Y gastric bypass and sleeve gastrectomy procedures. The comparisons were based on the assistant level, whether it was a resident, a fellow, or a non-trainee. The non-trainee basically included either a physician extender, a nurse practitioner, another attending, or the surgeon just operating by themselves. We accounted for baseline preoperative data. We looked at 30-day complication rate as previously described by our group. And we looked at clinical outcomes, which involved anastomotic staple line leak, 30-day readmission, reoperation, reintervention, the development of complications, and operative duration. So looking at operative duration, as you can see, for laparoscopic Roux-en-Y gastric bypass, there was statistically significant difference between the fellow and the non-trainee, as well as between the resident and the fellow. That same pattern was also noted for the robotic Roux-en-Y gastric bypass, as well as for the laparoscopic sleeve gastrectomy. As you can see, obviously the absolute time is less for the laparoscopic sleeve gastrectomy. So the fellow had a longer operative duration than the resident for those three procedures. When we looked at robotic sleeve gastrectomy, we saw that the fellow and the resident had a higher operative duration than the non-trainee. However, there was no difference between the resident and the fellow. And on the bottom there, it shows the overall. Next slide. So looking at the trainee impact on laparoscopic Roux-en-Y gastric bypass, there was no effect for either the fellow or the resident for the leak rate, the 30-day readmission, 30-day reoperation, or reintervention. However, for the development of complication, the fellow did have a higher rate, as you can see in this blue-colored box. The odds ratio was 1.31 for this group. More specifically, the fellow had a higher rate of superficial surgical site infection as well as urinary tract infection when compared to the non-trainee group. However, when we accounted for operative duration, this effect was no longer observed. Looking at robotic Roux-en-Y gastric bypass, we actually saw a similar pattern. There was no effect for either the resident or the fellow on leak rate, 30-day readmission, reoperation, or reintervention. However, the complication rate was higher. The main thing to note here is that the odds ratio is almost double what it was for the previous one. And this one was more specifically for urinary tract infection. The fellow had a higher rate. When we accounted for operative duration, this effect was no longer observed. Looking at laparoscopic sleeve gastrectomy, there are a few findings here. So for the resident, specifically when comparing to the non-trainee, which is this group here, outlined in green, we saw that there was a higher leak rate, 30-day readmission, 30-day reintervention, and a higher complication rate with resident participation. With fellow participation, we just saw higher readmission rate and higher complication rate. What was interesting, and those specifically were for progressive renal insufficiency, pulmonary emboli, superficial surgical site infections, and urinary tract infections. What was interesting here is that when we accounted for operative duration, the fellow impact was no longer observed. However, it was still seen for the resident participant. For a robotic sleeve gastrectomy, there was actually no impact from the resident or fellow on 30-day readmission, reoperation, reintervention, or complication. So our conclusions for this study, the fellow participation is overall safe for both robotic and laparoscopic bariatric surgery, although we did see an increase in minor complications such as urinary tract infections and surgical site infections. There was no negative impact on major safety benchmarks such as leak rate and 30-day reoperation. Furthermore, as we mentioned, the odds ratio for the robotic Roux-en-Y gastric bypass for the complication was almost double what it was for the laparoscopic Roux-en-Y gastric bypass, which indicate that the fellow has more of an impact on those surgeries. Furthermore, when accounting for operative duration, the negative fellow impact was no longer observed, which may indicate that with more practice and operative experience, these negative complications will no longer be observed. And lastly, resident participation in laparoscopic sleeve gastrectomy did unfortunately have a significant negative impact on laparoscopic sleeve gastrectomy even after accounting for operative duration. However, resident participation was safe for both robotic and laparoscopic Roux-en-Y gastric bypass procedures. Thank you.